Well, Gauteng health facilities are coping with the current surge in COVID-19 cases. The health minister conducted a walkabout of two of the province's biggest hospitals, and Appel reports.
The health minister undertook a site visit to two of Gauteng's biggest healthcare facilities, Steve Biko and Charlotte Maxeke academic hospitals. He's confident of Gauteng's readiness to deal with the surge.
I am confident that we will handle. Not that things won't go wrong, there will be problems here and there, but nevertheless, this team and this health system, with all the weaknesses, is the one that has actually helped to deal with the health of our people.
But Mkhize says it's still too early to be able to say what the migration of holiday makers back to Gauteng will do to the province's numbers.
Now Gauteng has started showing a slight trend downwards. We're holding our fingers crossed because in the first instance, it's still too soon to know what is the impact of the people who come from all over, particularly the coastal provinces which had a high level of infection.
He believes the downward trend in new infections is an indication of the effective use of non-pharmaceutical interventions. Meanwhile, the CEO of this hospital says the alcohol ban has been the greatest gift healthcare workers could ever have received.
For the first time for 24 hours, we did not have a single gunshot. People who came in was somebody who slipped on the carpet or something like that. Our nurses and doctors went to the helipad for the very first time to celebrate New Year.
On top of the trauma endured by doctors and nurses in the normal course of their work, drunk patients add insult to injury.
Health workers work very hard, especially in the public sector. And the last thing they need is to be terrorized by the very same patients that they have to treat.
The minister says 51,000 healthcare workers have tested positive and about 600 have lost their lives across the country to date. Appel, Johannesburg.